Hey, welcome back. This is the third part of section 1 in counseling techniques, and that is types of counseling. There are 3 types of counseling, that being individual counseling, family counseling, and group counseling. Although the objectives and the uses of these can be quite different, the actual techniques or counseling techniques we use in them is pretty much the same. Okay, so the first is individual counseling, and individual counseling is probably the one we'll do most, and that is your one-on-one counseling with the client. And in one-on-one counseling, we're really exploring different problems and their possible ramifications. We're also exploring clients' beliefs and attitudes, considering alternative solutions to those problems, enabling the client to come to decision making, and then lastly, using different therapeutic approaches. Those therapeutic approaches we'll discuss a lot in the later sections, but generally things like behavior therapy, REBT, client-centered therapy, and so on. Family counseling, which involves us counseling family members or maybe even counseling the family in a group kind of scenario, is really a whole different ball game and requires a whole separate segment of training, because most of what we're taught as addiction counselors is dealing with the addict. And so we do have another course, another CEU course on family counseling that focuses specifically on family counseling. We won't go into a lot of that in this course. We'll cover mostly individual and group, but a couple of things that we can just address. First being theories of family codependency, because that happens a lot, especially in addictive relationships. It happens in loads of the relationships, but primarily in 2 areas, which would be a romantic relationship, as in a normal person being in a relationship with an addict. And I use the term loosely because what we need to understand is anyone who stays in a relationship with an addict for an extended period of time are not okay themselves. And then secondly would be the relationship between the parent and the addict. And I guess what we see a lot of here is that parents will become all consumed with the life of the addict because they're constantly covering up for them, bailing them out of trouble or a jail cell, having to go around to dealers and pay off debts, and going around to friends to check up and try and find them, phoning hospitals, all that kind of thing, and it becomes all consuming. So much so that oftentimes when the addict gets into recovery, parents are left feeling like they have no purpose. Like their primary purpose for being has just been removed. And that's often a very difficult thing for the parent to deal with. Another thing would be techniques in getting the family motivated to be involved in the treatment process, which unfortunately is not always possible, because families tend to have the outlook or the attitude that the addict is the one who's sick, and so we don't need any help, and that's really not the case. But when the family are willing to be involved in that process, it's really handy to be able to deal with a lot of the other underlying issues that are happening in the family dynamic before the addict actually relieves treatment, so that a lot of the things that they might face once they leave have already been addressed or dealt with. And in that, there's also techniques in multi-family group counseling, and this is where we can have the family sitting down and confronting certain issues between each other and how to facilitate and mediate those processes, which is also vitally important if we can get that done before the addict leaves treatment, if they're in treatment, that is, of course. And then also I think it's important to mention just that sometimes we need to have a separate therapist or counselor working with the family. And this is oftentimes suggested because the family will have a whole different range of issues to deal with compared to what the addict does. But more importantly than that is, if we think about the relationship that is developed between the counselor and the client, you build up trust, you build up rapport. Now when you start counseling together with the rest of the family, the client might start to get the impression that you're backing family members up or picking sides, It might damage the trust in your relationship, and that can be quite detrimental in the counseling process. So sometimes it's useful, if you're going to do a family group scenario, to do it in conjunction with the family's own therapist or counselor, is another thing to consider. And then just lastly is role playing. And we'll cover this technique in a few ways in the counseling techniques in the sections that follow. But this would be where, if you're counseling just the family alone without the addict present, the family could role play a few scenarios on things they want to confront the addict about, or bring up or address, and experiment with various ways of doing that. And similarly with the client or the addict is to role play with them certain scenarios on how they might want to approach a subject with the father or the mother, and to decrease the anxiety around doing it by trying over and over again in various different ways and with various different outcomes, how to deal with those situations. Okay, the last of these three is group counseling. And group counseling is really where the counselor sits down with two or more people and you have a group. We'll discuss group counseling in the group counseling section in a lot more detail, but just a couple of things we want to think about, or that I could bring to your attention, is firstly, there's two major benefits to group counseling as opposed to individual counseling, and that is that at first, clients or members of the group are able to, until they feel more comfortable, hide. And what I mean by that is they can sit on the sideline and just observe what's going on in the group until they start to feel a little more confident, start to understand what's going on in the group, and will then feel okay to participate. So comfort is one element. And then secondly is feedback. Feedback can be a lot more powerful and hard-hitting if it's coming from quite a few people, compared to when it's just coming from the counselor. Because the client can argue with the counselor, but you can't argue when you've got 15, 20 people telling you the same thing. So once we decide we're going to start a group, I guess the first thing we've got to consider is, what type of group is it going to be? As there are many. Is it going to be a support group merely, or is it going to be a psychoeducational group where we are just really educating the clients or doing some kind of lecture or workshop? Is it going to be an interpersonal process group? Is it going to be a cognitive behavioral therapy group? And once we decide what type of group we're going to have, then we need to decide what is exactly going to be the purpose and function of the group. What is the desired outcome? We need to kind of have an idea of that before we start the group, as we don't want our group to be directionless. So what are we trying to achieve? What are the goals and objectives? And then we also want to decide what model of group. Is there a particular kind of model of therapy that you want to use in that group scenario, that you want to apply? And then lastly, we need to consider what would be the expectations of the members of the group. So what are the requirements for being a member of the group? Sometimes group members might want to do some kind of group orientation process where they sit down and write out the rules. So if you want to be a member of this group, you need to regularly attend this group and on time, or you need to have a certain level of commitment towards the group and to your recovery. Are you allowed to give feedback or not? Are you prepared to accept feedback from other members? What would be the consequences of bad behavior in the group, or maybe relapse, and that kind of thing can be decided. But we'll as I said, we'll cover the different types of groups and everything else in a lot more detail, and especially group leadership. But those are some of the basic elements we want to think about and objectives of group counseling.